Thanks, Premier, and good morning. So just on today's numbers, there's quite a bit of detail here, so please bear with me. 13 new locally acquired cases today. One is the case who contracted the virus at the MCG, who's returned to Mildura, so our new Mildura case. There's another who is his household contact, so that's 2. 4 additional cases are linked to Miss Frankie, all who dined at the venue, so that's 6. There are 2 more linked to Trinity Grammar, another 2 students, that's 8. One is a social contact of the Phillip Island case, so that's 9. One is linked to Amy Park, I'll speak more to that shortly, so that's 10. Another one linked to Young and Jackson's, that's 11. One is linked to the Bacchus Marsh Grammar, who was in isolation during their entire infectious period, that's 12. And one is our first case emerging from the Euro Finals event at the Crafty Squire, so that's 13. That final case at Crafty Squire is of concern. It is absolutely an example of how quickly this variant is moving and the short time we're seeing between exposure and then being infectious and onward transmission. Previously, last year, we would not have seen any circumstances where someone who'd been exposed was transmitting to someone else a day and a half later. Less than 48 hours later, simply was not seen last year with other variants. And so while we acted as conservatively as possible in declaring Crafty Squire a high-risk venue, we didn't necessarily expect there to be transmission there. So the fact that it's occurred some 30 hours after being exposed is absolutely a feature of the Delta variant. This is not the only circumstance where we've seen that rapid transmission from exposure to onward transmission. So anyone who is present at the Euro Finals event at Crafty Squire in the early hours of Monday, so from 3 a.m. to 8 a.m, must isolate, get tested and quarantine immediately for that full 14 days. I also want to talk briefly about MCG and Amy Park. You will have noticed that we're updating what we call the contact definitions for these sites, Tier 1, Tier 2, etc., based on new information we found in the course of our investigations. When information changes, we have to make those changes to our approach as well. It's the right thing to do, and it relates to new information that tells us about risk. In previous outbreaks, even last month, we've had cases at MCG and Marvel Stadium in seating areas with no onward transmission at all. But we are seeing transmission between strangers, including those who didn't sit near each other, including people who sat outside for their entire time. So we're expanding the number of primary close contacts from the MCG. Just to remind you, primary close contacts from the MCC members reserve for the Carlton Geelong game are those who attended Percy Beam's bar between 4 and 4:30 and then again between 5:20 and 5:50 p.m. People who entered Gate 2 between 3:53 and 4:06 p.m. That's been upgraded by just a few minutes, 3 minutes to 4:06. People seated in sections N40 to 46 on level 2 of the members reserve. That's been extended from sections N41 to N45, and our Mildura case was at the margins there, and that's why the extension of these sections has occurred. Again, normally you wouldn't see transmission out in these areas. And others identified as having close contact with the confirmed case who are present have obviously been contacted directly. If you're a primary close contact, you need to immediately isolate, quarantine, get tested, and have that 14 days in quarantine following your exposure. You can call the department on 1300 651 160. Other than for the above, all other areas of the MCC members reserve remain at Tier 2 sites, so that's isolating, getting tested and remaining isolated until you get that negative result back. Then you're free to go about your normal business. It's true to say if you develop symptoms at any point after that in the 14 days from exposure, you should get tested again. If you're on level 2 of the members reserve at any stage and have already had one test, I am requesting that you obtain a second test when possible following your first test, again reflecting that upgraded risk. That's really out of an abundance of caution. If you don't have symptoms, you don't have to isolate while awaiting your second test result, but if you have any symptoms at all, you have to remain isolated until that negative result. We're also expanding the number of close contacts and Tier 2 contacts at AAMI Park. Today's AAMI Park case was seated in an area of the ground that was not anywhere near the initial case in question. We think that transmissions occurred at the pinch point on entry. As a reminder, our definitions of AAMI Park were if you were seated in sections 22, 23 or 24 in Zone 2 on Level 1, or if you entered Gate 7 between 7:56 and 8:13, then you had to isolate, get tested and quarantine. And anyone else who entered Gate 7 or anyone seated in sections 25 to 42 are Tier 2 contacts who need to isolate, get tested until they get that negative result. Based on this new case, we're now also declaring sections 81 to 91 of the grounds as Tier 2 areas, requiring you to get tested and isolate until negative. And there's a map on our exposure site's website of the ground which highlights those areas that I've just discussed. So just to reinforce the message from the Premier, Delta variant is hugely challenging. It is an absolute testament to contact tracing that all cases thus far have been linked. I don't think there's been an outbreak of this size in Australia where all cases have been linked. It is a testament to the, sometimes 3 hours of interviewing that are done with cases to look at each and every exposure site that they've been to. That is really helping us make sure that there are no cases of unknown acquisition out there where they're transmitting to others unwittingly. So we are able to chase down these cases much more effectively knowing that. But it's still hugely challenging. Those 30 hours between exposure and onward transmission makes it extremely challenging for our contact tracers. Yes, Victoria defeated the Delta variant in the last month. We were in lockdown when we did that. There is no other jurisdiction in the world that has driven a Delta variant back down to zero. Singapore, which I would have thought was one of the best placed in the world to do so, are now battling numbers that are akin to New South Wales. We've seen modelling in the public space from New South Wales and Victoria that means that there might be ongoing risk north of Victoria for weeks or months to come. We don't want to be in that position. There is no absolute guarantee that we can win against Delta variant. We have to give ourselves the absolute best chance, but we have to recognise just how profoundly challenging it is with this new variant. It is not a question of locking down for a short period of time versus life as normal. Life as normal puts at risk hundreds of cases becoming thousands of cases, becoming tens of thousands of cases. So these are awful and difficult decisions, but we cannot pretend that it's simply a choice of locking down or not having to worry about it. This will take off if we allow it to. We do have to extinguish each and every chain of transmission because even in places across the Northern Hemisphere with high vaccination coverage, yes, they're decreasing the number of deaths that they're seeing, the pressures on their hospital system, but it's still ramping up. Even as the UK experiences Freedom Day, as they're calling it, 50,000 cases per day. They are expecting 200 deaths per day to potentially occur as they go into their next exit wave, as they call it. These are profoundly challenging times with this virus, in particular the Delta variant. We have to win, we have to extinguish it, and we need that assurance through an additional period to be determined to make sure we get there. Thank you.
Just very quickly
frame it in this way, knowing what you know about our contact tracing team's capabilities, the current level of exposure sites, and how much this could go up in terms of the curve. What is your best advice to the Premier at the moment?
I can't give you a specifics around time required. We've only got 4 days of experience of our lockdown so far. We are just beginning to see the real benefits of that lockdown in terms of the cases that are emerging today. So we do need the remainder of today and whatever happens overnight to be able to make that full assessment. It's not a question of contact tracing capacity. We've got the best contact tracing capacity out there. It is absolutely a question of how tricky it is with a variant that is so infectious and moving so quickly.
With the one that's in isolation today, I believe it's 4 that will be reported tomorrow.
4 on the books so far. We'll have more, there's no question.
Yeah. How is the trend, though, over the 5 days, just on that key marker? Because the Premier said on Thursday, that's the key marker, the number of people in isolation. What's the trend been like over lockdown?
Look, it is an improving trend over time. We are seeing people who, yes, they're out in the community for some of their infectious period, but it's becoming a smaller and smaller period of time. I think I spoke to 1.7 days average for cases the other day. It stayed like that yesterday. We're probably looking at a shorter period now. The initial test results we're getting back from people also have higher CT values, which means lower viral loads. So we're probably picking up people earlier in their infectious period as well, which means they're less likely to transmit to others. That's another good sign. But these are all separate elements that need to be considered in full over the course of today.
Do you have any further info on those 4 new cases?
No, not at all. They are just numbers on the books at the moment from my perspective.
We've been in lockdown 5 days now. Why is it that the lockdown is not having the effect of having people in isolation from their infectious period? Does it mean we're still picking up a lot of cases from transmission events pre-Friday?
Yeah, so certainly that. We're picking up people who've still been to events pre-lockdown. But also you have to remember that lockdown reduces the number of exposure sites that people have been to. It reduces the number of unique close contacts they have. That's very useful from a contact tracing and transmission point of view. It doesn't stop people from going out for food, going out for other essential reasons. And so it's only when you identify people and tell them that they have strict quarantine, where they do not leave the house, do not see anyone else, do not open the door to anyone for any reason other than emergency reasons, that you've got a true quarantine period for someone. And so that requires you to identify those primary close contacts and get ahead of the virus.
Chief Health Officer, we have some idea of the lay of the land now in terms of our COVID outbreak. So what are some of the options that are being considered about the extension of this lockdown?
To be announced tomorrow.
Was the person with the Crafty Squire a worker or a patron at the Euros final?
A patron.
And same with the Young and Jackson, was that a patron? Or
I believe so, yeah.
And is the new Bacchus Marsh case a teacher or student?
A student, I believe, but we can
Just
check
on
on
the case that went to Mildura, can you just confirm why you've asked people that went to the MCC to retest? Is that got anything to do with the case that went to Mildura?
Yes, so that individual was at the margins of that outside area that I've listed, right near Tier 2 areas. Our Tier 2 advice is get tested, isolate until you get a negative result. Because we've got transmission to that individual, we do want people who are in that Tier 2 area to retest to really make sure, out of an abundance of caution, that they have not picked up the virus. We cannot make the whole of the MCG a Tier 1 site, quarantining tens of thousands of people and overwhelming testing with tens of thousands of people. That would be overreach. We think the risk is very low, but we do want people to recheck with another test.
Did the Mildura case, just on that, did the Mildura case...
How long was this man infectious in the community?
So to be determined. There are interviews ongoing. Had an initial negative test. That was a true negative test. I'm aware of rumours about it being a false negative. It wasn't a false negative. It's been retested. It was negative, but a subsequent positive test. We would go 48 hours before symptom onset. There are some new exposure sites by virtue of that.
Sorry, are there enough testing kits in Mildura? We're getting reports you've run out.
There are additional supports coming to Mildura. The Premier has some details.
So there's a pop-up clinic that has been
Just a
established.
second wave last year question, actually. I know New South Wales had this debate about essential work or not. What worked the most last year? Was it defining what was essential work, or was it going into those essential workplaces and checking what was going on? Which one of those things had the biggest impact?
I mean, it's always so difficult. There was a huge, complex bundle of interventions that happened in Victoria's second wave, and how you tease apart the individual effect of each and every one of those elements is hard to say. Clearly, we've tried to investigate that. We've got an understanding that there was a lot of transmission that happened in workplaces and then cycled through households, and so we know that those were significant issues. We know that mask wearing was actually more effective than we might have presumed before that intervention. It's contributed 40% in terms of the total reduction in transmission through the second wave, something akin to that. But it was the stage 4 lockdown that drove numbers down faster. The peak at close to 700 cases went down with stage 3 and masks, but it wasn't enough to get to where we needed to be come October. But in terms of exactly how you tease out what those specific interventions were, it's hard to say. I think you need to do a lot of work preemptively in workplaces to manage that risk. We saw the explosive potential in some particular work settings, food distribution warehouses, abattoirs. That's been replicated across the world, and so those work cohorts, the PPE that was implemented in food distribution and healthcare, aged care, and abattoirs, were really effective measures as well. The attestation about not being unwell when you turn up to work, and the contact tracing that gets initiated both within the workplace as we do it with our teams in public health, were all elements there, but it's hard to know exactly the contribution of each.
And are you willing to tell us when and if you've spoken to Kerry Chan?
Look, I've spoken to Kerry actually while I was on leave. Always happy to pick up the phone to support, provide advice, lessons from Victoria. Clearly, our lessons were learnt in the fires of hell. They were awful, hard times for us. But we've changed so much by virtue of those experiences, and I think we've got valuable insights that we've shared through HPPC through the last year.
On the MCC retesting, the advice, don't need to isolate if you don't have symptoms. Is there a chance people could be asymptomatic?
Look, if they've been tested and they're very low risk, we don't think that's an issue. It's always the case that you can have no symptoms and still transmit, but we think these are very, very low risk individuals. We just want to make sure that we're not missing anyone.
On the Amy Park cases, I've heard from several people who were there. Some of them have received as many as 4 conflicting text messages. They've been told they were tier 1, then they were told they were tier 2, then they were tier 1 again. They were also told when they were told they were tier 1 that they would receive a phone call from the Department of Health. They haven't received that phone call. What's going on there?
So there are updated messages according to the risk assessment, and the Premier spoke to it. I've spoken to it in terms of what we find out about where transmission has occurred and how we therefore need to categorise those close contacts. There will be different advice that's given by virtue of those elements, and if people have been upgraded to tier 1, there will be advice. It's the first aid advice, if you like, in that text message, and we'll follow up with a phone call as soon as we possibly can. But people need to accept that advice will change based on the assessments that are made. These were individuals who were not sitting together. We think that there was a pinch point on entry into the stadium and not through the same gate. That's going to bring in a lot more people. We just need to cop that reality, and everyone who's attended needs to cop that reality as well, and do what the guidance is through those text messages and the follow-up phone calls.
In some cases, there are groups of people who... Sorry, could I just finish on this topic? In some cases, there are people who were sitting together in a group together. They entered the stadium together and they've received different text messages. Why would that be? What's going on?
Look, there are some text messages that have gone out by virtue of that time going through Gate 7. We know that was absolutely a pinch point and was a risk of transmission, so it might have been related to that, and they may not have
entered through the same gate at the same time.
Oh, look, I don't know the circumstances there, if they indeed entered the same gate at the same time, or if they had tickets booked separately and therefore had been bundled separately, but I don't know the circumstances. Right.
How many healthcare workers have been furloughed as a result of some of these big exposure sites like the MCG and Amy Park?
Look, I don't know for some of those exposure sites. There are just the odd healthcare worker through some of those Metro Melbourne sites, but Mildura's got the biggest furloughing. There's a few dozen there, but the numbers may change over time.
How many healthcare workers are in isolation because they're close contacts?
I don't know. Don't have those figures.
Testing. The numbers of people coming forward to get tested from the MCG and Amy Park matching up with the ticket sales or the attendance records?
Look, as the Premier's listed those percentages that have come through, we're at more than half for a number of those, but they are big sites and they have had expanded numbers over time. We'll see how much we get to 100% for those, but we'll be looking to try and have more than 90% of those back. But that's the numerator and the denominator. We want to see all of those test results, and we're cross-checking it against those numbers.
To reach out to those people that haven't come forward.
Oh, we're using all of the mechanisms between QR codes and the ticketing system, so they're complementary, and some of that relates to how people move about. They might have gone to the same food venue, even if they're from different subzones. So we'll use all means.
There are a number of schools that need to operate for at least 14 days in full isolation now. What's your advice to the principals about how to go about that? And perhaps maybe the Premier wants to expand on this for parents as well. As the lockdown continues, what message do you have for parents as this looks like to be an extended remote learning stint?
Look, it's particularly tough in the world of schools, and I'd call it homeschooling. It's not homeschooling. Our parents are not teachers. We are, and I include my family in this, trying to support kids who are getting remote learning while parents are trying to do parenting things at home. It is really challenging. For those schools where every student has been considered a primary close contact, yes, they're going to have to go through that full 14-day period. That's particularly tough, but they will work through the remote learning as a consequence of that. We have to drive this variant down to zero. The UK, which has got high vaccination coverage, had over 300,000 kids out of school in the first week of July just from reactive closures. We do not want a Delta variant established in the community with ongoing transmission that will do more damage to all of our activities, including schooling, if we allow it to run. That's why we are working so very hard to snuff it out now.
So when you say go down to zero, some people interpret you as meaning that you want to see zero cases for a long period of time, even close contact, even people fully in ISO.
No, I'm talking about zero community transmission.
Yeah.
It's the national strategy. Premier Berejiklian has referenced it with good reason. The alternative is hundreds turning into thousands, turning into tens of thousands of cases. I know that there will be an ongoing risk from international arrivals through whatever breaches that might occur. There's no system that's perfect that means that we are not at risk from the international pandemic that surrounds this country, that is getting worse in many areas, including in Asia. So I'm not in a fantasy world where I'm pretending that there is no risk across the globe. There is, but we need no community transmission in order that it doesn't spark again and that we're just dealing with hundreds and thousands of cases again.
One question then on the stadiums. You talked about how people have been infected who didn't sit right next to one another, but they might have met at a food turnstile or in the gate or in the Percy Beams bar on level 2.
Yep.
Is there any evidence of transmission out at the seating? And the point of my question is, has any of this transmission changed your understanding of the risk of stadium transmission for the long term?
Yeah, look, I think so. The Delta variant shows that transmission within stadia absolutely occurs. We think that there's been outdoor transmission, probably at the MCG and at Amy. I mean, Amy's outdoor seating. We don't know if it's at seating. We've got individuals who were not seated together. There's no evidence that they've attended a food venue together either. We think it's a pinch point going into the stadium outdoors. A lot of people reference the fact that we don't hear about transmission outdoors. I think some of that relates to the fact that you've got casual contacts. You'll never know that they came together, and so they end up as being a mystery case. When you've got contact tracing that is identifying exactly where people have been, but you know that they've been outdoors, then you're starting to pick up some of that outdoor transmission as well. It's lower risk. It's much, much lower risk, but it happens. We have to re-look at the public events framework and how we help manage that as we kick off public events down the track.
Can you tell us anything more about
on that
the four
question,
cases
will that-
that Premier mentioned?
Sorry, Rachel.
Sorry, can you tell us anything more about the 4 cases?
No, I've got no details other than that they're on the books for this morning. Sorry.
Can you tell us more information about the second Mildura case, the age, the gender, whether they were in isolation?
No, I don't have that information. That's again just through overnight.
And given this Mildura man has tested negative, then tested positive, how confident can you be that you won't see more cases like that come out of the MCC?
Oh, look, there are normal circumstances where someone tests negative early on in their incubation period. The point about strict quarantine for 14 days when you're a tier 1 exposure site, when you're a primary close contact, is that it doesn't matter that you've got a negative test early on. You've got that 14-day incubation period where you could become positive. That's what's happened in this case. It really is used early on in the incubation period to identify if someone's become a case, because they then get looked after as an infectious individual and their close contacts are followed up. But it doesn't mean that they can't test positive later on. For the tier 2 contacts, I do think that's different. We're talking about very low risk individuals.
Does it give you some confidence that he probably wasn't infectious during that early period, Sunday, Monday, Tuesday, when we've got those exposure sites in the Mallee and in Mildura?
Yeah, I think so. Not absolute confidence, but a certain level of confidence that unlikely to be infectious at the time of that negative test. You know, there are some tests that don't work perfectly. The Delta variant also appears to be one in which you're infectious right around the time that you test positive. And so that's another tricky element with this variant.
And just one,
just on children eventually being vaccinated, do you recommend that children be approved for Pfizer?
Oh, so whatever vaccine goes through the Australian Register of Therapeutic Goods through the TGA approval process for kids will be terrific. We haven't got any yet. If that happens with Pfizer, fantastic for 12 plus and maybe younger age groups as they go through the safety and efficacy trials for those younger cohorts. But if it ends up being another mRNA or other type of vaccine, fantastic. It's protecting kids for their own sake, but also helps move us towards that herd immunity and, protects you from the exit wave that I've referenced in the UK, where you get hundreds of thousands of cases because you've still got a significant proportion of the population who can't yet be vaccinated.
Rewind a little bit, just back to Paul's point about crowds and stadia, and just ask the follow-on from that. Is it unlikely we'll go back to 75-85% of crowds at major sporting events because of what we're learning out of this outbreak?
I really don't know. We have to assess it. We're going through a process of what other risk mitigations can be implemented, the kind of engineering or infrastructural or organisational changes that can help manage that, but there's no question it looks more challenging than it has previously.
And just while we're on the sporting beat,
Sorry, Simon, then Laura. Well, it might be harder subzones, more entry points, more staggered entry into those arenas. Who knows what else we can or should look at pre-event testing with rapid antigen tests. Vaccination status of individuals, that I've always said that needs to be a national consideration. We shouldn't be going out alone on that, but all of those things should be in play, I think.
And are you or the department dealing with the AFL just regarding some of the players apparently that are in the league that have been to exposure sites?
Not me, I'm not dealing with them. DJPR may well be.
And Premier, maybe could I just ask you, is the government working with the AFL on any ramifications about their season, and also how...
We found out about Miss Frankie and F45 in Richmond 3 days ago. The next day we were told about another restaurant, and then on Sunday we were told about Coles. Late last night we were told about Precinct Hotel and Bastion Collective. Do you know if these are linked to the same person?
I'll take that on notice. There's a lot of information there. I'm not sure if it's all the same person, but can come back to you.
If it is the same person, how has it taken over 48 hours then to
I'll come back to you with the details.
Professor Sutton, do we have enough contact tracers? You've sent an email recruiting for a contact tracing position.
We'll always be recruiting contact tracing positions. There's a natural turnover for some staff, but we've got enough. We're working with incapacity. The time frames for the case interview, the isolation of contacts and the contacts of contacts is working fantastically well, but there'll always be recruitment going on.
Just to start then, if we can cast your mind back to March and April, might seem like a long time ago, restrictions were quite, loose or light back then. Obviously, we didn't have the Delta variant in Australia at that point. Do you foresee going back to that before everyone's fully vaccinated, or does Delta change things?
Oh, look, I hope so. Of course, we just need to see what the risk profile looks like across the country when we're out of this. We all want the freest life that we can safely get. People will always feel frustrated by recommendations or mandates for mask wearing, the limits on various venues. We don't want any of that to be in place more than necessary. But we keep getting reminded of the risks and how they emerge. And I think the transmissions that we've seen just in the last week tell you that we need to be on guard in so many places ongoing. I hope that most of that can be managed through the least restrictive measures possible, but it's not a case of pretending like the risk doesn't exist. It will carry on for some time until we've got that very high vaccination coverage.
Does 5 days ever really stick to get control of these outbreaks?
It does sometimes, and clearly you have circumstances where that initial case only passes on to household members. It all gets contained. The lockdowns that happened in WA, Northern Territory, Queensland, with the Delta variant, really only saw transmission in very limited circumstances. If you start with a super spreader event, or if there are people in an apartment block who are multiply infected, you've got a different challenge on your hands. But you can manage that sometimes with a short, sharp circuit breaker. When it doesn't do enough, you need to reconsider.
Parents at St Margaret's Grammar in Berwick were sent a letter on Saturday saying that a community member had tested positive and the school would be closed. There's been nothing more in press conferences or in exposure sites about that school. Can you clarify what's going on there?
I don't have the details. Happy to look into it for you, Rachel.
And any information on a positive case at the South Melbourne Primary School?
No, nothing yet.
We just had some questions from people in Tier 1 exposure sites isolating for those 14 days. Can you just clarify what the rules are around what days they need to get tested?
So there'll be a prompt from the Department of Health. I think it's within the first 3 days, and again right at the end of that quarantine period, day 13. But I can give you the specifics.
And just on your conversation with Professor Chant, did she call you or did you call her? And I guess what advice did you offer her?
Oh, look, I won't go to the specifics of it. We were put in touch over a phone call. And really, it was a conversation about any particular challenges in New South Wales, any particular reflections that I might have had about how Victoria could help, or lessons that we might have had historically. New South Wales has helped us through tough times last year. We are here to do whatever we can in return.
And was that conversation before or after they decided to toughen their lockdown?
It was before.
Last question.
The detail on the 4 cases, sorry?
No details yet. They are just hot off the press.
Have you seen the VCOS ad or the Melbourne Symphony Orchestra ad encouraging people to get vaccinated?
I have. Terrific ad. The idea of a positive motivational ad is terrific. As the Premier's suggested, there's not great hesitancy. I don't think we need to push people to vaccinate. There's a lot of people who are ready to step up, but something that frames it in a way that makes people see exactly the world that we're trying to move to is a good thing. Right.
Any other issues?
Premier, just
Tomorrow.
Thank you. Thanks, Brett.